Okay, thank you very much. Hello, everybody, and welcome to our second plenary panel discussion of this year's Water and Health Conference. My name's Clarissa Brocklehurst, and I'm an adjunct professor at the Water Institute at the University of North Carolina, and I'll be moderating this panel. Before we get started, let me remind you of a few housekeeping issues. French interpretation is available for this session. If you haven't used it on the previous plenary panel discussion, you can find it down at the bottom of your screen. There's interpreters standing by. And just to remind everybody that these sessions are recorded. Now let me go on to our panel discussion. Like the first panel that took place earlier today, we'll be discussing the COVID-19 pandemic. We learned a lot about how COVID-19 is transmitted and the importance of hand hygiene and access to water in the previous panel discussion. And this time we'll be looking at the response at both the global level by international institutions and by governments at the country level. And we've got a great lineup of panelists today. I'm very grateful that we have representatives of 3 countries. It's a great honor to have the State Minister of Water, Irrigation and Energy from Ethiopia, Dr. Negash Wagesho, with us, and also Engineer Robert Kakubia, who is the water regulator in Kenya. We're also very pleased to have Dr. Beverly Ho from the Department of Health in the Philippines. And to give us the international perspective, we're going to have representatives from UNICEF, WHO, and the World Bank. So welcome to you all. But before I turn to our panelists, I'm going to ask Katerina de Albuquerque, the CEO of Sanitation and Water for All, to say a few words about an aspect of the response that I think is particularly powerful, that is collaboration. We see collaboration between development agencies who are working together, collaboration between development agencies and governments, and we've also seen South-South learning and exchange. So Katerina, can you say a few words to kick us off about this aspect of the response? Go ahead.
Thanks so much, Clarissa, and good morning and good evening and good afternoon to everyone. I was planning to say that that it's a pleasure to be here. Actually, it's not. I would be much happier if I was right now in Chapel Hill and not in my basement. But it is the world we are living in, and thank you nevertheless for having me here today. Let me start by telling you a little bit about SWA, so that you understand where we are coming from and why talking about collaboration is so essential for everything that we do. We were set up 10 years ago, and collaboration is indeed in our DNA because we are the product of collaboration. And many of the people on this panel today were the witnesses or the authors or plotted for this birth to happen, because they realized that, to use the words of the former Deputy Secretary General of the United Nations, Jan Eliasson, none of us can do everything by themselves, but we can all contribute to something bigger, and we all have a role to play. And actually, we were practicing collaboration. Collaboration is part of our strategic vision for the next 10 years. Collaboration is one of our guiding principles. We also have in our framework collaborative behaviors that we support or we inspire our partners to apply. And when the COVID pandemic hit, we basically continued with business unusual, but based on our DNA. We have, besides the multi-stakeholder engagement, our 2 other objectives are mobilization of political will and also attracting finance for the sector. So it's within these parameters that we operate. What have we done? And we did it again in partnership. For example, we started by realizing that we wanted to offer our partners, we have approximately 300 partners, a platform with clear and accurate information about the pandemic. And then we partner inter alia with WHO and UNICEF to bring the science, to the partners. And we had 2,000 people in one of the webinars. We then organized a ministerial webinar with 5,000 people. And the idea was to drive, in the ministerial one, was to familiarize government officials with the finance that was being made available for the COVID-19 response. In our interactions with ministers, and also with the development banks, including the World Bank, we started realizing there is something getting lost in translation. And one of the things that we saw was, for example, that in a given country, CSOs representing people with disabilities had the chance to explain to the sector minister the importance of having people with disabilities involved in the planning processes for WaSH in COVID, for the COVID response. And then actually the minister granted them a request, and they met with them and in order to participate in the planning. Then we started organizing, because our webinars were very big, we thought we should have smaller exchanges. And we started organizing meetings with a few ministers, just 2 or 3, and then other partners, in order to foster collaboration, to understand, okay, what are the problems that the ministers are facing in the context of COVID, and how can other partners around the table support? And we had a couple of those. We also had partner exchange forums with the private sector, but also civil society and academic institutions. One of them was organized by the UNC to discuss how to balance the need to protect consumers, particularly the most vulnerable, and ensure that they also have access to water to combat the disease, and also that the measures put in place also take into account the need to ensure the financial sustainability of utilities service providers. As Clarissa, you were mentioning South learnings, then we also started organizing those, and we saw a big interest from our partners to learn from others in this context of COVID. Just to give you an example, we did this also with UNICEF. We did it on washing schools, and this learning was articulated around Côte d'Ivoire sanitation program in rural schools. Then we did the second one, focus on sanitation markets, and this was articulated around the sanitation services delivery project in urban and peri-urban Benin. These are just some examples. Then there was a moment where I must confess, when talking with several of our ministers, I realized that their frustration. They were telling me that they were not being invited to be part of the national COVID response committees, nor were they receiving money, the COVID, any slice of the pie, as they would tell me. They were not getting any slice of the pie from the COVID response money. And I remember just feeling very irritated and frustrated. And that's when we had this idea of putting together a world leaders call to action that was not to be signed by sector ministers, but by heads of state, heads of government, heads of UN agencies. And I think it was this moved and shaped also the sector at the national level, not in every single country. I will not attempt at pretending that this was the case, but we know that in some countries, the sector ministers use the call to action to go and talk with the head of state and say, you signed this call to action, bring me in. make me as a part of the response. And there were interesting side effects at the national level in terms of collaboration between the different stakeholders in country. And the call to action actually had an impact or an impact in further collaboration at different levels. For example, the Hand Hygiene for All initiative by UNICEF and WHO that they partially attribute and link to the call to action, or the Hand Washing Day event with the USAID current administrator organized by USAID also as a follow-up to the call to action. So we saw that this had a positive impact in those terms. To conclude, I think that what is both exciting and difficult in the work that SWA was and is mandated to do is that it takes everyone to work together to make it work. It's not a tiny secretariat that can do it. So, and I think that then we suffer from, and we benefit also from the difficulties and the good things that happen in the sector. There is, I think that in the context of the COVID response, there are great examples that showing that together we can do much more and much better. And I think that I have never talked as frequently as now with colleagues here on the panel on a day-to-day basis. But so it also allowed us or pushed us to do all of that. Now the challenge is, let's keep it now in the months to come during COVID and also after COVID in the recovery, because we really believe it shouldn't just be part of SWA's DNA structure, it should be part of the sectors, I would even say, of the development sector's DNA structure. We need to work together, we need to collaborate. It's the only way to achieve the SDGs. Thank you so much for your attention.
Hey, thank you very much, Katerina. Very, very nice. Thank you. And that's a good segue into our panel. And so I'm now going to turn to our panel, and I'll ask you all to turn your cameras and microphones on so we can see you all. There we are. Great to see you all. And I'm going to start by calling on the representatives of the international agencies who've joined us today to talk about what they did at the global level before I turn to our representatives from the 3 countries, even though I know our audience is going to be most interested in what actually happened in countries, where the rubber hits the road, so to speak. But I'd like to look first at what international agencies did to try to provide support to their country counterparts before we turn to them. So I'm going to turn with a question first to Bruce, Bruce, Shoma, and Kellyanne about their actions, on what they did to launch at the global level to help countries with their WaSH response to the pandemic. And I'm going to ask you to speak about how these have evolved over the last few months, from the immediate response in the spring to longer term response as we go into the autumn and winter, and particularly how you've coordinated with each other and with other international agencies. Because I know that you've all worked very closely together, probably more closely together than you ever imagined you would be working together. So Bruce from WHO, can I call on you to open this up, and then I'll turn to Kellyanne and Shoma?
Thank you, Clarissa. And yes, we're working closely together, but it just occurred to me that I have this very strong urge now to see everyone physically, including everyone at the meeting. But yes, a lot through the virtual side of things. Yeah, I think it seems a long time ago that this happened, that this started, and I think we certainly, sort of from a normative perspective, did exactly what the first session here at UNC did, and that was really try to clarify the science. And we had done that quite, this traditionally, looking back at the original SARS. Looking at the influenza viruses, there was avian influenza and swine flu, which became, I think, H1N1, and Ebola. And there was some reports of GI issues, and there was some worries, I think, about fecal oral transmission. So that really needed to be sorted out quite quickly with the evidence that we had. And so that was really the first thing we did. But I think in and there was a paper that we did with UNICEF that has been continuously updated in that respect as well, looking at the role of the virus in terms of WaSH and WaSH practitioners. But the other thing is, when you look at WHO and what it was struggling with really at the beginning, there's a tremendous lack of diagnostic testing capabilities. There's a tremendous lack of therapeutic availability, so oxygen and things like that. There was a huge need for PPE. People were fighting. And so and I felt like my role was quite interesting, because you're sort of looking at what WHO is sort of being forced to kind of pay attention to first, and then you have this WaSH community. And as Kelly will attest to, as the sort of co-founder of the JMP, the Joint Monitoring Program, we were at a point where we knew there was tremendous vulnerability in terms of hand hygiene access and general WaSH access. So the worry at that from the outset was that, depending on how things went, and I think Africa has become a pleasant surprise as of yet, that there'd be a tremendous spread because of this vulnerability. So we really, we meaning I think WHO was very impressed by the WaSH community, because the WaSH community came to WHO in essence and said, hey, where is WaSH in these strategic response plans? As Katarina mentioned, that they are not being funded. Where is WaSH in terms of ensuring that there's enough hand hygiene stations, and how can we ensure frequency of hand washing? So the other part of the puzzle was really to get out some strong kind of advice to member states to ensure that there's obligatory hand hygiene stations in public places, transport hubs. We see that now. I think most people are quite familiar with the sight of alcohol-based hand rubs and hand hygiene stations everywhere. But at the time, it was not everywhere. And we also had the COVID response plans really highlight WaSH. And I mean highlight WaSH not just because it's a no regrets investment, but highlight it because it's an essential service that would be influenced by by all the, as a secondary thing. So those were the kind of things we were really promoting, but at the same time we were looking to partner with the WaSH community. We worked very closely with Kelly. Maybe she can talk about the Hand Hygiene for All initiative, which is a tremendous kind of amount of effort that went into that, and that will is evolving to a whole of society approach. And I just was also struck by what Katarina said about the leader's statement and just the whole WaSH community working together. And again, I haven't seen people as frequently as I have today. So, and over the last couple months, the hard part, and maybe I'll conclude with this, Clarissa, is, I think we secretly see this as, not secretly, it's overt secret, but we need to do something in the long term about hand hygiene for all the other diseases and for all the other reasons. And we need to do something about WaSH in healthcare facilities, and WaSH in schools, and WaSH in prisons. And so we really hope this could be transitioned into something that lasts and matters more. And so we're incredibly grateful to begin discussions with people like Robert and Nagash and see what their experiences are like as well. So maybe I'll stop there.
I've made the classic error of not unmuting myself. So thanks for that opening, and I think you put Kellyanne on the spot, so I'll turn to her next before going to Shoma. But I really like these points that you've raised, that we were very aware that we were starting from a less than perfect base, and also the no regrets nature. This is going to protect, the work we do now is going to protect us not only against COVID-19 but against future pandemics. So Kellyanne, on the basis of that, would you like to weigh in, and then I'll turn to Shoma.
Great, thanks so much, Clarissa, and just really echoing just what a great opportunity it is to be here today. And I think, Clarissa, just thanks to you, because I think after I don't even know how many months it's been, but this was really the first opportunity to really reflect back on kind of the arc of this crisis and our response. And I think to start off, the first thing I want to say is we had to create a global response. And I was thinking about what did it take to kind of build this up. And I wanted to talk about four components. And this isn't a component, but it was sort of the zero space that Bruce was talking about, was that we had to realize that we were in a global crisis. And I think, you know, when we look back at kind of a trajectory from December to January to February to even March when we were traveling, I mean, we could see it building up, but how we had to very, very quickly kind of trigger this global response. And so I think the first component, and as Bruce said, that was essential, was the work that WHO was leading together with other partners to really define what is the WaSH response to COVID-19, and you know what were going to be those evidence-based interventions, because before we could start programming, we had to really know what we had to do. So once we started to get those programming interventions, I think we moved quickly on into this aspect of the programming guidance. And so that was something for UNICEF as an organization that had WaSH programs in over 100 countries, development programs. What is it now that you're going to do to respond? And I think, you know, we quickly identified that WaSH was going to have a critical role in stopping the transmission of the disease, both through kind of hygiene promotion as well as through infection prevention control. But we very quickly understood when we looked at not only the virus and the transmission of the virus, but we looked at the response to COVID and what that was bringing in with lockdowns, restrictions, transport. So everything that we've known how to do as humanitarian responders around mobilizing a response was going to have to be adapted to the response to this pandemic. So that was, I think, really the first component, was developing this technical guidance and programming approaches and getting those early country examples about how to do it. I think the second part was really scaling up. And I think that's where we really started to see that we had to move very quickly to be able to shift programming and resources to be able to move what we were already doing in healthcare facilities, what we were already doing in schools, to be able to now adapt it to the needs for the emergency response. I think another thing that maybe some of us didn't expect was how many countries that didn't have, you know, lots of development actors and other types of WaSH programming were now calling on organizations like WHO and UNICEF to support on the response. And we've had this happen in regions like Eastern Europe and Central Asia, also in Latin America, where, you know, for example, in a country like Brazil, UNICEF didn't have a WaSH program, and we now had to have a WaSH program with 20 staff coaching them remotely. So that was a big one. How do you train people? How do you do all of this in kind of a remote phase? The third component was really WaSH in the global narrative and the funding streams. And I think, as Bruce pointed out, this was, and Katerina as well, this was a challenge from the beginning, because in the public health emergency pillar system, it isn't by sector, it's by different pillars of the response. And you have the communication through the risk communication and community engagement. You have a pillar on infection prevention control. You have a pillar on case management, where there's all WaSH components, but how does it fit into that? And so I think what was really critical, and some of the work, again, that we did in partnership, was using things like the platforms that Katerina was talking about with SWA, using different ways that we were communicating how WaSH fit together, and was a critical part of funding. And I'm sure Soma will talk about the work that the World Bank did and other IFIs and development banks to try to get that emergency funding to be able get to WaSH. And I think just lastly, I think the last thing we did, and maybe the one that is currently the most memorable, was trying to see how we take this to scale. And I think what we've learned is that while there's this once in a generation opportunity that everyone's making hand washing videos, talking about hand washing, how can we convert this into sustainable gains? And that's where I just wanted to point out three things that I think are really exciting that are going on, that are crossing over from this response to the recovery to the long-term gains. And one is the Hand Hygiene for All initiative, where we're looking at this whole of society approach that built on this guidance that WHO released. The second one was really around the school reopening and the frameworks that we've been working on with the education sector to make sure that WaSH in schools is very much a part of all of the Safe School protocols, and that funding streams that are going to the education response are also covering WaSH. And the third one, again, is another collaboration with WHO, which is the work on WaSH in healthcare facilities, which was very much having a lot of momentum and a lot of interest with the World Health Assembly resolution and the GMP reports. But this was also very much vital to build on the work that was happening. And now, how do we leverage this going forward? So those, I think, are just a few things, Clarissa, that I wanted to share about how we had to kind of build this together, and how we've now kind of through these initiatives tried to build in ways that we can keep working together as this is a protracted crisis, and also help us go into development.
Thanks very much, Kellyanne. And I think that's very interesting. And I hope that when I turn to our representatives from governments, they will also reflect a bit perhaps on the challenge that you pointed out, which is that water sanitation and hygiene tends to be spread out over multiple ministries, multiple sectors. And as you've said, that sometimes makes the response quite complex. But first, I'd like to turn to Shoma. Shoma's here, and I want to say huge thanks to Shoma for stepping in at the last minute when Jennifer Sarr from the World Bank was unexpectedly unavailable. So you're a real trooper, and thanks for doing that. And would you like to talk a bit about the World Bank response and some of the work that you did, particularly with utilities?
Thank you, Clarissa. It's a great pleasure to be part of this panel. We've been working very closely with Kellyanne, with Bruce, and also with our clients. Very nice to see Dr. Nagesh with us. Just before the pandemic set in, we were actually doing a massive workshop in Africa to talk about universal access to sanitation and looking at how do we create a momentum around political commitment, public financing, make it a people's movement where hand washing would be a very important element, and also working about partnerships. Until then, we did not know that we were in the middle of a pandemic or in the beginning of the pandemic, which might create a different way of looking at our engagement in water and sanitation, and especially like how we would like to engage in a more emergency response immediately. I would echo what Bruce and Kellyanne just mentioned about working at scale. So I would like to highlight a few points what the World Bank is, how the World Bank has been addressing and what the World Bank is focusing on. The COVID-19 pandemic actually demanded the World Bank engage with this unprecedented speed, scale, and selectivity. We are looking at the 3 S's right now, although before it, we were looking at 4 Ps. So at the onset of the pandemic, the bank has been responding in 3 ways, working with our global partnerships to align around a common WaSH sector response, which Kellyanne and Bruce mentioned, and including Catalina also mentioned in her opening remark. Intensive communications with our client countries to understand their urgent priorities and realigning our existing programs towards meeting the emergency to the WaSH needs, and especially working with where we already have very active WaSH programs and also countries where WaSH programs are still not there. and developing our more structured responses aligning with the World Bank's 160 billion funding through the 4 pillars. I'm sure you all have heard about the 160 billion dollar commitment that the bank has already made, and especially around the emergency health response and building back better, looking into your, first of all, in your immediate responses and how shall we move towards a medium and long-term approaches. So if I start with at the global level, our partnerships with UNICEF and WHO has been very, very critical to coordinate our global messaging and advocacy on the critical initial interventions needed for the healthcare responses. And we worked hand in hand with UNICEF, with WHO, and with SWA and other partners to ensure that we get the right messages. We don't have to reinvent the wheel, but build upon what WHO and UNICEF were working on, especially on the evidence that WHO and UNICEF have put forward to help focus our health emergency responses. Our messages linked to the urgent need to provide WaSH in healthcare facilities, in schools and in public institutions, and especially also in the COVID hotspots, and also mobilize quickly to deliver the hand washing program at scale. Also at the high level political forum and sponsored by the UN Water, we joined other heads of the UN agencies to advocate on the accelerator framework for SDG 6, as well on SWA's call to action to build the political support needed to advocate for the policy changes to leverage financial resources. The finance ministers meetings are at the regional level are becoming an effective tool to reach out. How do we make structured or more focused financial needs for the WaSH sector. Along with 2030 WRG, we are also working with and supporting the private sector collaborations. And we've seen that the multi-stakeholder platforms are also becoming a very effective tool to bring the private sector along with clients and our global and our local partners to work together in carving out the messages, as well as helping the client countries to ensure that how we can address the speed and scale and ensuring that private financing are also being leveraged. But also more importantly, we continue to build the evidence to influence policymakers and academia. I would say the UNC is also a good way of working together in building up the evidence, particularly in areas where we still do not have a very concrete responses, especially in the fragile and conflict affected areas. We have already have some evidence working with UNICEF in the MENA countries, but more and more, many countries are in a fragile and in a states, and especially how do you ensure resources reach out to these conflict affected areas? Once we started engaging with our countries, we realized that not only do we need to support the agreed to priorities that we just mentioned about on inclusion of WaSH in emergency response in WaSH responses, as well as on the hand hygiene behavior changes, but also more importantly to working with utilities, especially in a context where governments have mandated suspensions of payment for water supply and sanitation service cost recovery. And we've seen that cost recovery has fallen almost half, threatening financial health of the utilities. As such, the bank is putting a huge emphasis on ensuring the continuity of services by utilities and service providers to maintain and restore operations, remain financially viable, and build back better. This is a huge area, and this is where we are giving a lot of stress to ensure that we get quick feedback, how these utilities are facing, how can service providers be provided with more just-in-time support, with financial as well as with knowledge, and ensure that the emergency responses to COVID are being addressed. I just want to highlight some of the countries, how these utilities are facing. In Middle East and North Africa, cost recovery has actually fallen from 65% to 27%, while in Latin America, we find it fell from 90% to 44%. We see a similar issue in Kenya as well as in Uganda and many more countries. We can cite all these examples of falling of the financial shortfalls, and especially on how do you make these utilities be more cost viable as well as financially viable to ensure continued water supply and sanitation. We cannot do hand washing if there is no water in the pipes. We cannot even do point of use water treatment unless there is quality water in the system. So at the same time, we are also working with small scale providers to find out what are the similar stresses these small scale providers are working, especially looking into from our SMEs and see what kind of financial resources these SMEs need to ensure that they have been able to also provide, build it up to address to the scale and to the speed on ensuring that the last mile service deliveries are also being made. As a response to this, we have created an emergency response and recovery plan framework for water and wastewater utilities to minimize the impact of the pandemic. We are also engaging in the capacity building work with the utilities. Kellyanne also mentioned about hand holding in terms of how do you ensure hand washing as well as point of use water treatments are being made. But we are also working with the utilities to ensure that these utilities can build it back in a much more sustainable manner. We are already working in 17 countries across ECA, LAC, Africa, and SAR. In terms of the World Bank financing, we are working hand in hand with our clients to restructure our existing projects and also to provide additional resources to the projects that are already in operation so that they can respond to the COVID emergency in a fast track manner. At the same time, we are also realizing that there is more attention to be given to the healthcare emergency response. And as such, we believe there is where the WaSH sector needs to align with the healthcare, with the health team, as well as with the urban team to ensure that they can obtain greater resources and ensure WaSH becomes also an important feature in the healthcare emergency responses that are being made. So out of the 80 projects which have been updated so far, 35% involve activities to improve access to water and sanitation in healthcare facilities, and 70% include hygiene and hand washing activities in these healthcare settings and in communities. More and more, we find that there are lots to be done across in the hotspot areas, and the role of water sector is contributing to be the rebound and recovery for the global COVID-19 crisis. We are supporting a resilience recovery in which we start how we can restart the economy, promote investments, create jobs, and build back better. So I would like to say that in my concluding points that the water sector actually can play a very critical role in job creation and boosting the economy. And we need to ensure the water supply and sanitation utilities have sufficient access to financing, promote labor-intensive services expansions to water supply and sanitation utilities, as well as in the irrigation and drainage areas, and extend water supply and services to the low-income communities by working with the local governments. It's just not the utilities, but also with local governments, and bring in SMEs to ensure that the last mile delivery has been done. Improve bulk water services in health, in sanitation, and in the economy. Thank you.
Okay, thanks very much, Shoma. Thank you, and thanks to all three of you for explaining the international response. But now we're going to turn to our esteemed panelists from Ethiopia, Kenya, and the Philippines. And we're going to ask them what WaSH responses did you initiate in your countries? And tell us about the challenges that you experienced and what successes you had. But I'd be particularly interested to hear, in the light of what we've heard from WHO, UNICEF, and the World Bank, what assistance you found the most valuable, and what really worked in terms of as the pandemic evolved. And I think we've heard from our three panelists so far that things really changed as time went on. As Shoma said at the beginning, we didn't even know we were in a pandemic. So it'd be interesting to hear what you found most valuable and how things changed. Dr. Nagash, can I call on you first from Ethiopia to tell us about your role in coordination of your country's response?
Thank you so much, Professor Clarissa. Yeah, really very impressive. Honorable Chair, speakers, panelists, and attendees of this virtual session. Really, I feel much honored to be part of this big event in order to share some of the COVID-19 pandemic response initiatives associated to WaSH with respect to Ethiopia. Well, some of the countrywide responses initiated in Ethiopia are the Ministry of Water, Irrigation and Energy being a leading institution in order to coordinate all WaSH sector actors, including sector ministries like Ministry of Health, Ministry of Education, Ministry of Peace and Security, and all donor partners, NGOs, other private sectors like consultants, contractors, WaSH suppliers, even including businessmen and outspoken personality, celebrities, the media at large. So created a WaSH sector coordination platform. That is really a big platform and subdivided into a technical team responsible for water supply and sanitation, service provision, resource mobilization team, advocacy and learning team as well. So this team communicates periodically, both physically and virtually. In some instances, those people who are working very close with us, especially the government side, been taking physical meeting as well, in order to identify some critical areas in terms of WaSH supplies, isolation and quarantine sites, vulnerable sites like refugees, returnees, and even internally displaced centers, which lacks water supply and sanitation services. Through such joint effort, we could able to mobilize significant amount of resources in terms of cash and WaSH supplies. We could able to provide hand washing facilities at major public spots like hospitals, health centers, police stations, marketplaces, and other communal gathering areas, even including prisoners area. And we again developed a strategy to supply water supply service at utilities to serve for 24 hours. That was really a challenge for us. Usually Ethiopian water utility operators for certain hours, and others became off hours. But this day we could able to operate for 24 hours. So through this joint effort, we could able to reach to 159 isolation and quarantine centers, 36 vulnerable areas. These are refugees and returning centers, and 100 community premises of vulnerable areas. So we could again able to link the WaSH COVID response with social protection. That is the productive safety net program. Again, those low-income areas, low-income communities and households get access to these WaSH services. We extended water supply and sanitation water fees, electric bills, and even water supply utility loan repayment schedule, which was really very critical for urban utilities. Again, apart from that, all WaSH sectors experts, like the water and health sector experts, remain on duty since the first case of COVID, which has been reported in mid-March in Ethiopian condition. So through this joint effort, we provided water supply for 4 million population. This is unserved population in the previous existing context, and 300,000 refugees and returnees, including IDPs area. So some of the success stories which we observed are the top political leadership, full commitment and engagement. Really, the government of Ethiopia redirected resources, allocated funds for emergency response, even allowed us for direct procurement of emergency WaSH items. exempted tax issues on major WaSH supplies like pumps, generators. These helped us a lot. The second one is the WaSH sector actors coordination and commitment. All donors, NGOs operating in WaSH sector, nearly 75 WaSH sector actors, all worked jointly, especially the support which we have obtained from UNICEF, the World Bank Group, African Development Bank is much appreciated. We worked as one family and we demonstrated a real One WaSH national program platform in Ethiopia during the COVID session. The other is the private sector engagement. Most hand wash facilities being provided by our private sectors, the water sector contractors, consultants, suppliers. They again provided temporary water storage devices, units like fiberglasses, etc., and fixed it at every spot. For us, that is also an interesting issue. From advocacy and learning category, the Ethio Telecom helped us a lot. It sends voice call message, text message for nearly 30 million people every session. When I say every session, when you make a call, you will get such a voice call message and the text message that alerts the COVID-19 prevention and prevention protocols. So we distributed millions of brochures communicated to vulnerable families through radio, TV, etc. But there are challenges still. Some of the challenges are, while we are fighting with COVID-19, we faced flooding. Nearly 180,000 population affected by recent flooding. And there are cholera outbreaks in some instances as well. The second one is resource limitation. The WaSH sector demand is quite high, even before COVID condition. Now, COVID condition exacerbated this particular situation. Dropping urban water supply utility revenue. Because of COVID pandemic, utilities cannot able to collect tariff fees. That is again another challenge. Shortage of imported goods like pumps and generators, usually in Ethiopian condition, are imported from abroad. We cannot do that as much as we can because of the lockdown. And the urban water supply utilities loan repayment schedule is again challenged. Some of the assistance we found most valuable is really the WaSH sector's donors, technical and financial support. UNICEF, World Bank, African Development Bank, as I mentioned. Continuous WaSH supplies at critical centers by UNICEF, redirecting some of the WaSH resources to COVID emergency by the World Bank Group, virtual technical advice and support in the fight against COVID by the World Sanitation and Water for All, securing additional WaSH capital investment from the National Treasury, from the government of Ethiopia. That's really important. In the previous 5-6 years, our WaSH capital investment is very small, but they increased 10 times this year. This is really a good initiative, which we observed from the government of Ethiopia. So through these efforts, we could able to save lives of millions of people. And these are some of the issues I want to share to you. Thank you.
Thank you very much, Dr. Nagash. A very interesting story. I look forward to engaging more with you as we get into the panel. So thank you very much for that. And I particularly liked what you said about the role of top political leadership. I think that that's very interesting, and perhaps we can follow up on that. Can I turn now to Engineer Gakubia, who is the regulator from Kenya? I know that Kenya has a particularly interesting experience, in particular setting up a liquidity facility for utilities there. So I was hoping you'd be able to talk to us about that. Thank you.
Thank you very much. It's an honor, of course, to be part of this panel and part of the conference. I think when we got the COVID-19 pandemic hit our country, the government, of course, did what it had to do. It basically made the call that water services must continue flowing, water must continue flowing, water must be accessible, must be available. And our water sector here is such that most of the programs that are ongoing, active, a lot of that financing comes from our development partners. So it was natural for government to look at the ongoing programs and the partners and see how flexible and how they can actually help the government respond to the pandemic. So as a regulator, of course, myself, I'm focused on the water service provider, because this was really the entity charged with the responsibility of making sure that people continue getting the WaSH services. So the emergency fund actually was supported by one of our programs. And I want to mention the World Bank program. It was flexible enough to actually engage, and government was also very happy in terms of engaging with that program and seeing how they can actually respond as fast as possible to the pandemic. So, and that response was to be focused on water service providers. The regulator comes in very, very critically here because of the information that is required to guide the response that we may want to implement. And within less than a week, we were able to get all the information, the data and information we needed from the water providers in terms of how they have been affected, because the government, of course, gave some directive that no water disconnection should happen, and also even to power companies that they should not even disconnect electricity supplies to these water providers. And that of course helped. But when you say that water should not be paid for, it directly hit the revenues of the water service providers. So the support that we discussed and actually restructured one of our major World Bank programs was to provide immediate liquidity support to the water service providers so that they are able even to make sure that they reduce the anxiety of their O&M staff. And they were also able to make sure that they are able to meet the O&M costs that are required to actually to keep the water flowing and contain the spread of the COVID-19 through provision and sustaining the water provision. So that grant was designed very fast, and we also made very, very robust estimates for the next from around May up to December. But the providers were also to have more support linked to their own performance, because I want to say that when you have a situation like we have here, where we already have weak providers, most of the providers are weak. That means they have underlying conditions, and it's very difficult now when a pandemic like this one hits for them actually to contain or to sustain service provision. So the support was in two parts, in terms of making sure that the water is available either by provision or through direct provision or through extension of connections where feasible, and also installing public water points to actually support hard hygiene. But we were also now to support the providers to make sure that not everything that they say is actually linked to COVID, to help them even address whatever other underlying conditions they were having, and make sure that they look forward even post-COVID as to how they intend now to make sure that services continue and the post-COVID recovery is actually on course. So, and for that to happen, we require the providers, all of them, to provide a business continuity plan. We supported them in trying to at least establish a template as to how that can be done. We also require them to provide us with what are the emergency responses they need to address the water requirements in especially the low-income areas. The advantage we had here as a country is that all the providers actually have mapped their low-income areas. So we immediately knew where the vulnerable populations are, and it was actually easy to respond. The only problem, of course, is that you are not actually led with the intervention, but we can quickly assess the area and actually come up with a quick intervention to make sure that people are not unduly affected. We want to really appreciate the support from partners who we are working with in the water sector. Of course, led by the World Bank, of course. We've had that very, very, very quick response, as Shoma was saying there. But other partners also came in to help. I'm aware that UNICEF was also helping because we had a USAID program that was ending and it was extended just because of the COVID recovery. Those are two programs by USAID, and many of the other partners who are also working on in terms of responses to this COVID pandemic. But I must really stress here that it is normally, when you're working in a fragmented sector, it is normally very difficult to respond. But that response was helped by having these entities already established. Because for me, I think when you are, as Clarissa was saying there, where the rubber hits the road, when you're actually focusing on a utility, you're actually directly impacting or affecting the consumers that they serve. And this is how our response has been, was actually very fast, and we were able to respond in a meaningful way and impact on the lives of the consumers. We also have those ones in the low income areas where sometimes, yes, they may not have even the facility themselves. So government came in through its own resources and actually provided water facilities for these people. But it also insisted that those water facilities have to be managed by the provider themselves, because if you're able to make sure that the providers are the ones managing, then you try to control the incidents or kind of cartels coming in to actually take control of these water facilities, and that actually makes it even not very, very responsive to the poor, in terms of requirement for their water services. So I think that is how we have structured the liquidity support, the water programs. And I believe, and I have seen the way we discussed it with the World Bank, is that even other partners can join. So it is still open for other partners depending on their own requirements with respect to how they have made their agreements with the countries that have provided the finance. But it is flexible enough to make sure that other partners can come in, because for me, I'm focused on actually having to deal with only one provider or one entity, so that you don't have a multiple actors, which now sometimes makes a coordination of the support, and even may bring in some duplication in terms of the interventions that you want to make at that level. So that is how the support program has worked, and I would be welcome to give more information if necessary. Thank you.
Thank you so much, Engineer Kakubia. Very, very clear, and some very interesting points there about both the advantages and the disadvantages that we started out with. So last but certainly not least, I'd like to turn to Beverly Ho, who is very patiently waiting to tell us about the Philippines. I should point out that it's very late at night in the Philippines, so thank you very much, Beverly, for joining us so late. And over to you.
Thank you, Clarissa. It's my pleasure to be part of this group. Well, in terms of what we have been doing, I would summarize them into three main buckets: amplifying messages, enabling individuals and communities, and sustaining feedback loops. In terms of amplifying, we actually launched a thematic 360-degree campaign with the overall theme of being the solution. No? So it's called Be the Solution in local language, but the entire theme is to encourage citizens to not be helpless in the pandemic and be part of the solution. And it pushes for four key behaviors, for which one of it is hand washing. Notable in this campaign is that we had around 40 plus private sector groups who've taken part in amplification of our messages, meaning they had to customize it according to their marketing campaigns, etc. And we were able to tap into their budgets for this. And this would include the top 2 online sellers in the country. So we were able to maximize their platforms. Second, in terms of enabling individuals and communities, we also partnered with the private sector to build hand washing stations in selected parts of the country, while we at the DOH, with the help of the Hygiene Hub, we were the ones who produced the stickers or the nudges that came with the hand washing stations. We were the ones who installed it as well. We also partnered with Hygiene Hub to develop the hand washing playbook for local governments. So this is a guide for how local government units who are primarily responsible for the devolved health sector in the country to implement these projects, no? And part of what's in the playbook would be, say, local ordinances or resolution that will be enabling for these acts, a sample like worksheet on how they'd go about planning the installation or even just planning the budgeting, etc., until the project gets completed. We've also been developing and training and retraining health workers as well as lay village volunteers and partners on risk communication and preventive behavior, and this would include basics of hand hygiene. Finally, for our sustain bucket, we have visited and worked with selected high caseload villages or barangays, help them assess their situation, their ability to abide by the minimum public health standards for which hand hygiene is part of it, and co-created solutions with the villages. We also do regular monitoring through third-party phone surveys and also facilitated discussions in our chat group. No? So it's an AI-enabled chat group for which people can ask questions. So what are the successes and challenges that we've encountered in the last 7 months of combating the pandemic? I know two things. No, first would be metrics for success. I would say that in the Philippines, our rates for hand washing as well as the other health behavior, preventive health behaviors, are persistently increased. No, and they actually are stable across the last 7 months. Although we note that, of course, they're self-reported, right? And there are limitations to self-reporting. We also note that as Kelly has already mentioned a while ago, that this statistic may be fleeting. It can be high now, but in a couple of months, when the pandemic scare is gone, then people might actually like revert back to their old behavior. And so while this we have good statistics, we also note that this might be short-lived, no? However, we also already note that the spillover of this success might not just be for COVID, but also for other communicable diseases, for which are still very much part of our epidemiology. Second would be partnerships and collaboration. We've noted in several stakeholders meetings, etc., there have been many initiatives by several of our partners, some primarily from the education sector, some with the health sector, some with the infrastructure sector. But the challenge has always been, I guess, finding synergy, to get to 1 + 1 = 5, not how we're doing it now, which is 1 + 1 = 2. No, so I look at those two main things as our challenges. And finally, on the question about what types of assistance did we find the most valuable, I would perhaps say that it's the private sector collaboration. No? We collaborated with a soap maker who supported our Be the Solution campaign. And I guess what we've experienced from the Ministry of Health is that the private sector does have a unique ability to market something into, I guess, something sellable, right? For which typical communication coming from the development sector might not be able to capture that imagination of the public. And so being able to work with them, learning from them, and actually as a result of this collaboration, we're also getting some technical assistance to help us market some of the other health behaviors that our office is responsible for pushing. It's actually has been very interesting. That would be all from our end. Thank you.
Thank you so much. Thank you. Fantastic insights. So the question that I'm going to put to the entire panel now, and I'll just point out that Jennifer Sarah has been able to join us as well. So thanks, Jennifer, for making it. the thing that I'd like you all to speak to is, you know, how can we find a silver lining in this pandemic, which is a dark cloud, but does it have a silver lining? What can we learn from it, and what vulnerabilities has it exposed that we can now address? And I think what I've heard some really inspiring things from the panelists so far about the need for flexibility, and the fact that flexibility was there when it was needed from donors and from partners, that it really helped to know where the vulnerable were. Partnerships with the private sector were very important. Having already established programs that you could then scale up seemed to be a big factor for success. But now there are concerns that we are still dealing with institutions in the sector that have underlying weaknesses. How are we going to make sure that recovery continues? And there's been some questions I noticed in the chat about how do we make sure that the investment that goes into the sector will actually give us the levels of service that we need in order to protect not just against COVID-19, but against future water and sanitation and hygiene connected diseases. I think we've seen that people need running water in their homes, for instance, that there's been real vulnerability among people who have to walk to fetch water and take it home. So, silver lining, anybody got any thoughts on what could be the silver lining and the good things that we have learned out of some of the hard times during the pandemic? Anybody want to jump in? If you don't jump in, I will pick on you.
Yes, maybe I can try.
Please, be brave.
Thank you very much. I think if I look at the vulnerabilities you are talking about, of course, the pandemic has highlighted the inequalities that we have in water service provision, and also the fact that they are a threat to all of us. It is really not a question that if you are in a well-served water and sanitation area, you are not threatened by an unserved water and sanitation area. They are a threat to all of us. And when you have weak water service providers and also weak institutional organizational arrangements, they undermine the response to any emergency, not just COVID. And the other aspect is on coordination, the weak coordination mechanisms that we have, which also undermine. So going forward, this pandemic has taught us where our public health emergencies would be, or public health problems would be. And then they are better dealt with a very robust policy and institutional environment. Because without formalizing water service provision, without formal water service providers, it's very difficult to actually even respond. You'll be responding in a very unstructured and uncoordinated way that even after that, you really cannot even claim accountability. You have nobody to really hold to account. And when you have a water provider already, it doesn't matter their stage of development, you can actually hold them to account. And in that case, if we focus on strengthening water service provision through water service providers, then you can actually be sure that the next response to such any public health emergency would be perhaps better. That means then we need to rethink our planning and our priorities. Are we really focusing on the whatever intervention we have on the priority areas? My answer to that, it's not enough, because we shouldn't be talking about inequalities up to now about water service provision if we were really focusing on those who do not have. What we try to preoccupy our time is improving quality of service for those who already have. Yet there are people who are still waiting for water services to reach them. Unfortunately, sometimes we look at the private sector to actually support us. I don't think we should look at the private sector. We should actually be looking at the public sector, trying to increase in terms of, yes, finance available, and even more importantly, improving the enabling environment so that finance can come. They don't have to go look for it. Once you have a robust enabling environment, financing will be available, whether it is from a private. And to do all these, then the data and information from the sector is critical. You can really not do much without the data that you need to help you focus on the basic water and sanitation services. But perhaps even to go further in terms of where you should respond to, these big investments we talk about should have to a large extent focus on water availability and reliability at source. Because just, for example, we were saying we are going to extend connections. Extending a connection presupposes that there is water available. So when water is not available, then that connection extension does not really help. Yes, there is a pipeline, but it won't help. I think that's my take on that.
All right, thanks. And thank you very much for being a bit provocative there. I think this question of how you balance the role of the public and the private sector is very, it's always a good one, no matter what.
Yes.
Any other want to come in on what's been said so far? Dr. Negash?
Yeah, thank you. Yes, the COVID pandemic has revealed us very significant gaps. Some of these are, we really observed very huge WaSH service gaps in public and communal premises, vulnerable groups location like health center, schools, public areas. Even in the areas where we have modestly good water supply access, during this COVID session, we observed critical gaps. And that is something which we learned from this particular emergency session. The second one is, we feel that in some instance, our water utilities are strong enough, but we observed that their low operational capacity. There is no dedicated water supply and sanitation operators. Most of them are easily threatened by these small financial shock because of the revenue collection issues, as they are dependent on the revenue collected from the consumers. The other is poor coordination at lower administrative level. We feel that we have good coordination at federal level with our donors, partners, private sectors, etc. But when it's down to the regional level, the same level of coordination is not available there. So this is what we have observed. And finally, the WaSH investment gap is quite huge. When we really observe that the supply and demand, there is mismatch between that. So it showed us to work on that direction in order to at least minimize the gap. So maybe if 2 points as a way forward, what I feel, because you are concluding. So we need further to strengthen our WaSH sector coordination. That's one issue. And the government should commit more resources in WaSH toward this WaSH sector. The other issue is utilities, rural water supply operators must be empowered in terms of tax exemption, in terms of WaSH supplies, in terms of either domestic or international loan provision, and establishing good governance in the sector. Public-private partnership need to be introduced in terms of financing, and maybe multinational donors and aid organizations bring WaSH as a primary agenda under their financing scheme. And finally, school reopening is on the way. So we need to really ensure WaSH in schools and healthcare facilities. These are critical issues. Thank you.
Thank you very much. So I'm being told that we're right at the end of this session. What I want to do is give you each an opportunity to say one final sentence. And I think very interesting, some of the things that are coming out about what we've learned. I've heard from both Engineer Kakubia and from Dr. Negash, the idea that we need formal providers that are in good health, enabled to be able to respond to this. So I'll call on you one by one just to say one closing sentence, one sentence only. Beverly, let me turn to you first, and then I'll go to the others in turn.
I think it's an opportunity for us to reinvent and reframe WaSH in terms of first making it part of a package of healthy behaviors and healthy settings instead of pushing for it as a single behavior. Second, to reframe it as a driver of economy. Third is to reframe it as something that is a must and it's not free. No? So to be able to put dollar equivalent to it as an investment so that we can get people to really invest in it. That would be all. Thank you.
Thank you. That was a very long sentence, but very good. Thank you. Thank you very much. Bruce, shall I turn to you for your final sentence? You kicked us off at the beginning.
Yeah, no, thank you very much, Clarissa. I was trying to think of a silver lining.
You couldn't think
Scratching
of
my head. But no, I mean, the obvious one is the urgency and the awareness, I think, that people are approaching WaSH with. I do worry that that's a bit ephemeral. If we didn't have this, I would imagine many of us would be talking about 2030 timelines. So it's just to say that I think, well, maybe just one of the issues with the vulnerabilities of the international response is that it's been tough, and we've kind of laid it out like it was a sort of a planned thing, but it's been frustrating as well. But I do think that one of the silver linings is this community, because it's just a tremendous community, and I didn't realize how tremendous it was until this COVID happened. So I'll end it at that.
Thanks. That's really nice. Kelly, can I call on you?
Yeah, this is a good one. I think just to say, yeah, just to kind of reinforce the idea of the urgency and the centrality of WaSH being part of the health response, being part of getting kids back to school, of getting people back to work. I think that's very important. But I think for me, what I've learned most from this has been, I think a lot of the things we're doing, we know the what we need to do, but it's been how we've had to do it that's been so different. And so I think that's what I would want to take forward, is kind of how we can take this learning and try to really unlock our potential. So, you know, we're 1 + 1 = 1,000 for WaSH. So, and yeah, be part of the solution.
Thanks very much. Shoma and Jennifer. Jennifer, we haven't heard from you. Do you want to make the closing sentence here?
Shoma, do you want to say something?
Okay, I'll just very quickly, as you said, one sentence. I would say that let's make our ambition a reality of all of government and all of society, so that we can work together with a strong and collective action. One last word I would like to mention is that while we are talking about the financial stress of the utilities, let us also make universal access for people and for all. And this is possible. We have to keep it in mind that there will be an additional 88 to 150 million new poor added. So we have to keep that in mind. Therefore, public leadership, public financing, and strong leadership is critical. Over to you, Jennifer.
And I'll just still have a sentence. The silver lining for me is that we're all here together. I'm really, really sorry I had an emergency, but great to see everyone. There's 400 people listening to this event, and we're bringing together the academics, the researchers, we're bringing together the political leaders and the practitioners. And that's what we need to do. Just keep on working together, global level, local level, and be committed. You know, this is our time for universal access. So thank you all so much.
Okay, thanks, Jennifer. Dr. Nagash or Engineer Gakubia, do you want to make a final point?
Yes, thank you. Just one word. Let's bring WaSH as a multi-sector, multi-partner, multi-financer business. Then we can really move forward. Unless otherwise, if we put it to international donors or to the government alone or to the community, we won't succeed. Thank you.
Thank you. And Dr. Gakubia, Engineer Gakubia.
Thank you very much. Mine is short. I think WaSH should be at the center of every socio-economic development initiative we are making, and government should lead the way.
Thank you. That's an excellent note to end on. Thanks so much to all our panelists. This has been a great discussion. Thank you all to all the attendees who've been listening in and commenting and sending good questions. That's the end of this plenary. The side events start in 15 minutes, but remember, all of you who are on this as attendees, you have to close this session and then go into your side events from the agenda. Don't forget to visit the virtual exhibit hall and the poster sessions. And thank you very much to all of you. It was a great discussion. Thank you and bye-bye.